welcome to the 2020 Brain and Transcranial Photobiomodulation Virtual Summit. I'm your host, Dr. Joe Dodaro, and my guest is Dr. Frederick Schiffer. He's currently a research associate at McLean and an assistant professor of psychiatry at Harvard Medical School. He's been studying the relationship between past trauma, cerebral laterality, and depression and anxiety, and has developed a hypothesis on the physical nature of conscious experience as it relates to the brain and to psychological function. He's also studied the role of near-infrared light directly through the forehead to the brain and how it may play as a treatment for psychological problems, including opioid use disorders. He's the founder and president of MindLight LLC and has been awarded a current NIDA SBIR grant for a blinded RCT of unilateral photobiomodulation for the reduction of opioid craving. That grant is a big deal. He's going to talk about that today. Thank you, Doc.
Hi.
You've got two patents that cover this method that you're going to describe here. So I think that's an amazing thing, and we're going to really have our eyes, our unilateral eye, opened up, if you will, to your presentation. Before we get going here, can you tell me a little bit about how a doctor you did a different type of psychotherapy, right? You're a psychotherapist, right?
Yes, I'm a sort of psychodynamic, in-depth psychotherapist.
Well, what does that mean?
Okay, it means that today most therapies are more superficial, where they're cognitive behavioral therapists, which are sort of affirmations, or if you have a negative thought, try and get rid of your negative thought. Whereas in-depth psychology is more Freudian. It's more what comes to mind, what are you feeling, and you use the feelings to explore the patient's mind. And what you come across are deep, subtle traumas that the patient experienced, and you work with the experience of the patient. And you find that their mother was condescending to them, and it was a great wound, and it's a deep pain, and you only find that through exploring these old experiences. And the work of psychodynamic therapy, or it's true with psychoanalysis, is to help the patient discover those traumas and learn how to bear them and grieve them and process them.
Nice. Well, I mean, it's a traumatized world. I mean, this is a great insight, for people.
Mm-hmm.
No, I'm a chiropractor, so we didn't do really a talk therapy. So I kind of got it.
Right.
This is all new to me. But so tell me how a medical doctor who graduated as a psychotherapist in 1971.
Yeah, actually, I graduated medical school in 71, and then I did internal medicine as an intern and resident. Then I did a fellowship in cardiology where I was at Harvard, and we studied the effects of stress on the heart. And I published two widely cited papers, and then I went into psychiatry to round out my education, and found out that I couldn't practice as a cardiopsychiatrist because the type A cardiac patients didn't want to have anything to do with the psychiatrist.
I love it. That was the point.
Cardiologist.
That was the point that I really wanted to kind of zoom in on, that you've spanned 5 decades. And just the demographic change, the ideological changes, but also the demographic changes. Back when you were doing it, when you did your residency, I bet that your population that you worked with, cardiac patients, was 90% male. And now it's more 50-50. Mm-hmm. So we start to understand how stress affects the heart, but you kind of went the other way and now are looking at the mind or the brain. So how did you make that transition, and then how did you get introduced to transcranial photobiomodulation?
Okay. I got into photobiomodulation via my work, my research, and so what I think I should do is explain essentially what I'm proposing is that you treat unilaterally to a brain hemisphere that is more positive. And so this is a novel idea. In other words, that the hemispheres of the brain have different minds. And I wrote a book about it in 1998, published by the Free Press. And and we've done a lot of research that I'm going to review in this talk. But the hypothesis is that the two hemispheres are associated with two different minds. One immature and traumatized, and the other healthy. And so I put the light over the healthy side to stimulate it, and I'm getting remarkable results.
That's positive. But who introduced you to the concept of what I'm saying is you are a, dyed-in-the-wool trained medical doctor that doesn't really, your epoch, the alternative therapies was not the big thing. You didn't get a lot of pat on the backs when you started to talk about allopathic treatments. What introduced you to light therapy or photobiomodulation? What did you get? What did the light go on for you?
Okay, well, again, it's part of a long story that I want to go over, but the short of it is that I found that the positive hemisphere, which was determined by wearing taped goggles that looked out one lateral visual field versus the other. And if you felt better when you looked to the right, it meant your left brain was more positive. If you felt worse when you looked to the right, then your left brain was determined to be more negative. So that's what the hemispheric valence is.
I got you.
And if you use that test, I went down to Alvaro Pasqualeone, who at that time was the world's authority on TMS, which was only given to the left side, and I brought some goggles with me and gave it to him, and I was surprised that he took them, and then I couldn't get the results from him. I called him, and he wouldn't return my call, so he was giving a lecture, and I went up afterwards, and he said to me, those goggles, they work. And so what we found was that, and I'll have this in my presentation, that there was a very accurate prediction of who would respond. And if you had a positive left hemisphere, you would respond to the left-sided TMS. It was always given to the left side. And if you had a negative left hemisphere, you did very poorly.
Oh.
And so I then replicated that with a clinic in Canada, and I wanted a method that I could use in my office to stimulate one hemisphere, left or right, so I called the Wellman Center at MGH and I just spoke with whoever answered. And eventually, they said, yeah, it could, if it doesn't hurt the skin, it's not going to hurt the brain. And I really didn't know a lot about it. I knew that near-infrared light went through the skull because I had worked with near-infrared spectroscopy. And so eventually I got connected with Mike Hamlin, And he and I related very well and started the first study on using photobiomodulation on the brain for emotional
There you go.
issues. Yeah.
There you go. There you go. Well, you know, some of the, I just wanted to get a little background because your work has come up in a couple of other presentations. So I wanted to hear it from you as to how you got going. So shall we look at our slides?
Yeah, sure. Pointer. Okay, it's not working, but there we go. Okay. So essentially, if you cut the corpus callosum, which is number 5 here, if you, and show a picture like where this G is, if the eyes were moved over here so that they could see it, it would hit this part of the retina and go over to the right brain. So if you show a pair of keys over here in a picture, the left brain can't see it. And the talking brain is the left brain. So the person says, I can't see it. But with his left hand, he can reach into a box and he'll pull out whatever item you show a picture of and just does it like an ordinary person. The right brain is a thinking brain. And it can pick out the item that you showed the picture. So it understands English, it can follow the instructions, and in tests that were done, it's quite intelligent. I think it has a normal intelligence. Michael Gazzaglia thinks it has a monkey intelligence, but I think it has a human intelligence, and we have an experiment that will verify that. Which
let me just ask you, so just to clarify, if you show a picture of the keys and where the G is, and you ask the person, what do you see? They say, I don't see anything.
Right.
Because it's cut. But if they reach their hand into the box and say, pull out an item, they'll pull out the key with their left hand.
Yeah, but not the right hand. So the right hand is controlled by the left brain, and the right hand has no idea what's going on.
So this is in the corpus callosum has been severed. So
that's right.
They don't see it, but they perceive it. Is that what you're trying to say?
They don't perceive it.
But they can reach in even at the same time. They can reach in.
Let me back up. Okay. The left hand is controlled by the right brain. So the right brain knows that it was a picture of a key. And it controls the left hand, and the left hand can reach into the box and pull out the key.
Got it.
The right hand can't do it, does not know what to pull out, has no idea. And if you ask the person, he says, I didn't see the picture. If you show the picture where the T is, the person says, yeah, it's a T or whatever you show over here, and he can see it and just like a normal person tell you what it is. And with his right hand, he can pick it out of a box.
Gotcha.
Now, but there is a kind of an interesting thing. They showed a picture to the left side of the person, went to her right brain, and she started giggling. And they asked the left brain why she was giggling. So the woman is giggling, but the left brain has no idea. And the answer that the woman gave was, "You've got a funny machine, doctor." It was a confabulation. What happened was Roger Sperry, who was a very distinguished-looking scientist, showed a Playboy nude, which in the 1960s was very risque. So she giggled at that, and so we understood why she was laughing, but her left brain didn't.
So she got the image, but she wasn't able to speak and talk about what she saw. She felt the emotion, but not the logic. Well,
the right brain, this is my point here, that it's a mind. in other words, the right brain has a separate mind. The right brain was able to see the picture, realize that it was a nude and it was inappropriate for the situation and was very funny. So that's why I say this is not a monkey brain. This is an intelligent brain that can have humor and get subtleties now, but the left brain is left out of this. He has no idea, or she has no idea on the left side what's going on. She didn't see the picture. So the idea here is that when you cut the corpus callosum, you create two minds. So I wondered whether the two minds in the split brain studies related to the two personalities that I was seeing in my practice.
Wow.
And I came across a study by a German scientist named Werner Wittling. And what he did was he had this very complicated device where he was purporting to show movies to one hemisphere or the other in intact people. And he got different emotional responses depending on which side he showed it to. And some were more sensitive on it was an upsetting film, and it was more upsetting to the left brain in some people and more upsetting to the right brain in others. And so again, it was an idea that the left brain is not good and the right brain bad. But it did support the idea that you might have a different mind in one associated with one hemisphere versus the other. So I couldn't afford the apparatus that Wittling had, but I realized that all he was doing was showing it to one lateral visual field or the other. So to do that, I created these goggles that limited vision to half of the lateral visual field. So if you looked over here, it would hit this side of the retina. The retina is divided into two halves, one of which goes straight back and the other crosses over. This is standard neuroanatomy. And if the eyes moved over here, it would hit this part and cross over to the right brain. So with the lateral visual field, you can stimulate the left to right brain.
I got you. So you're saying you used the lateral visual field to stimulate the medial part of the retina so you could get a unilateral brain stimulation on the visual.
Exactly.
Cool.
Exactly. Right, right. And then later, I'm going to use photobiomodulation to do the same thing.
Sounds good.
Only with photobiomodulation, it's so much more powerful. Yeah. Now this was powerful, and I wrote a book about it and did a number of studies, and I'll go through those. And the idea here is that in my practice, what I found was that if a patient has a positive left brain, and remember, it could be the positive side, and one side is always positive and one side's always negative, at least in 80% of people. In 20%, there's no difference. And whenever I've studied a neurologist or engineer, there's never any difference. I'm not sure what that means. But in anxious people, there's usually a very marked difference. They might have an anxiety of 8 on one side and maybe 4 on the other side. And they feel very different. Can
I make one question before we get? So when you say the positive side, is that positive for more of the negative emotions, or is it positive in the side that's the side that's working better?
No, it's in terms. Let me show you the next slide.
Okey-doke.
Actually, let me go one more.
It'll go. It'll go.
Tonight, we bring you word of an amazing medical discovery. It's not a bioengineered drug or a dazzling piece of high-tech equipment. This is a breakthrough treatment for depression and anxiety.
So let me move you through here. So that's me.
That's you?
Goggles more scientifically. Dr. Schiffer tested emotional responses.
So this is a patient who I'd never seen.
Different feelings with the right or left-sided goggles. He noticed that some had the anxious and pessimistic feelings in their left brain, others in their right brain. It would vary from one individual to another, and it was difficult to predict which side had which feelings until he tested them with the goggles. He also used brainwave studies in 15 test subjects to demonstrate that left-looking goggles indeed arouse the right brain and vice versa. I observed a volunteer test subject, a college student named Chris. It was his first time trying the special goggles. Neuroscientist Carl Anderson asked Chris to rate how anxious he felt while looking out goggles that were taped to allow him to see only out the extreme right side.
How much anxiety do you feel now? None at all? A mild amount? A moderate amount? Quite a bit? I want to say an extreme amount. Okay.
Chris also reported that he felt extreme tension and anger.
So this is stimulating his left
But
brain.
when he put on goggles that let him look out to the left, his reactions were quite different. When asked to rate his anxiety level,
I don't want to say I feel like none, but I don't feel like really anxious.
Dr. Schiffer asked Chris to retry the right-looking glasses that seemed to provoke him.
Tell me what you're feeling. I'm feeling like I want to take these glasses off. They're making me angry.
I want you to try this other pair.
Okay.
These glasses allow Chris to again see out the left side, and they seem to comfort him.
This side feels more easygoing, more
And this is within seconds.
happy-go-lucky kind of
Happy-go-lucky.
personality. The other side, I want to go to war with something. You know?
Go to war?
Yeah.
What Chris has just demonstrated in the lab is what Dr. Schiffer says he's observed in his patients. Their psychological suffering seems to...
Let me see if I can. So he's typical of a patient who have a good response. So, and that's about 60% of patients will have that kind of intense response in my practice and in studies that we've done, and in studies like the one that Alvaro did, he got similar results. He actually had more people actually responded in his studies than in my practice.
What was that number again? What percentage have that dramatic type of response?
I would say 50 to 60%. And in my practice, 80% of patients use the glasses as part of their treatment. So it's not just like negative emotions on one side and positive emotions on the other. It's a whole mind. So in this illustration here, I've got these clouds sitting over the brain. We don't think about minds. We've sort of lost our mind in psychiatry, and I'm putting it back in here. So there are hemispheres, but there's also a mind, and so when a patient looks out his negative side at me, I look critical, and he feels insecure and more anxious, more depressed. It's a whole mindset, and I'll ask him to look out the other side, and I look like a therapist. I look like a friendly person, and he'll say, might say, you changed your expression. And I didn't. And then I started using a photograph of Winston Churchill as a young man, and he wasn't recognized for who he was, and he looked critical out the negative side and friendly out the other side. And then when I said it was Winston Churchill, his public persona was that he was a friendly person, and so that there was a reality. It wasn't just whatever you perceive is the fact, and that's true with neurotic personalities, that they don't necessarily perceive the world accurately, so in this, so it's a whole personality. And my book, which I cite over here, is called Of Two Minds, and this is really what I was seeing clinically.
Let me ask you this question here.
Yeah.
So first of all, for some of our, I would say, younger attendees, they might not know that this is Marlon Brando up here.
Okay. Yeah.
And so the troubled personality is from Streetcar Named Desire. No, that wasn't that.
That's right. Yeah. Yeah.
Oh, that was it. It was a streetcar, was it? Because he was.
Yeah,
that's what he's yelling, Stella, Stella.
Yeah, that's what he's yelling right here. He's yelling Stella. Right.
And so he was. He was troubled.
No, well, he's an actor, and so he's playing a troubled personality, and I'm using it to illustrate something. But he's not. I'm not allowed to take photographs of patients or go to McLean and snap pictures of patients
Gotcha.
in different conditions. So I'm using Marlon Brando acting as a troubled personality, and a photograph of him
When he was calm and healthy. I got it. So my question is, the personality and the mind. What you're also saying, if I'm catching this correctly, is that if someone is shown a neutral picture, depending on their personality or their perception, they will say that this is an aggressive person, or they will see you as their mind perceives it. Am I getting that correct?
That's correct. Yeah, yeah.
Okay.
And then in their unaided view, they might be dominated by one side or the other, so that some people might be more dominated by their positive side and tend to see people positively. Generally, if someone's really suffering some mental condition, say depression or addiction, and they're really involved in it, they live in their negative hemisphere. And so they see everybody as negative. And you bring up another point. What I often use in my practice is a photograph of a very, very angry man. It's a provocative picture. And he'll, and I ask from 0 to 10, how anxious do you feel? And I see in most patients a big difference depending on which side I show it to, and so that's a test that it's in order to amplify the difference between the hemispheres to help clarify which is the positive hemisphere and which is the negative.
Just for so I understand that these people who are going around with a dominant or positive hemisphere are perceiving the world differently, and that creates emotions in them that they really can be troublesome, is what I find, right?
Well, no, if their positive hemisphere is dominant, then they're going to be perceiving the world in a healthy way and more realistically. If their negative hemisphere is dominant. Their negative hemisphere is affected by past traumas and is more immature, more neurotic. And so it's going to tend to be a little more paranoid, or a little more suspicious of people, or feel like people are looking at them and don't like them. And like the sense that I was being critical of the patient. But right on the other side, 2 seconds later, I look supportive and friendly. And they feel better about themselves. And if they have drug cravings, they're heightened on the negative side. So those, and they might want to use, and they say, you know, I came in, I didn't feel like using. Now I feel like I could use. And on the other side, the desire to the craving goes away. So that's why I say it's a whole mind. It's not just like a you know, feeling of anxiety or depression. It's perceptions, it's thinking. You know, they think more like a child. It's an immature personality. And that's the distinction. And in the next slide, so this is a paper I wrote last year. It's the physical nature of subjective experience or consciousness. But it's a subtlety, that's what I call it, a subjective experience, and its interaction with the brain, and you could add with psychology. And so I take this cloud seriously, or the idea of a mind seriously. I think subjective experience profoundly influences the brain and interacts with the brain. And so if you go around seeing things negatively, you're affecting your brain. And if you see them positively, you're affecting your brain. But it's something we don't tend to usually. So that and the physical nature that in my hypothesis has a lot to do with quantum physics and quantum field theory and I don't want to go into that here, but I think that there is a physical reality to the mind that's not in the brain. It's related to brain information, but it relates to a quantum field that creates the subjective experience. But I think that the mind actually exists as a physical entity. That's not substantiated; it's a hypothesis. But when I talk about a mind, I'm serious, and clinically, it's what I see.
You can feel free. You can feel free to elaborate on that as you go forward, because with us, we've talked about that in the summit. So people are investigating this, and it's valid for this summit.
Good. Okay. So initially, so this is a study we did in 1999, and we used EEGs, ear temperature, and measured affect changes, these over here are the experimental glasses. This is the right-sided pair. There's a left-sided pair, and then down here are control glasses. They're monocular, so they don't have the they go to both hemispheres. So if you look out just one eye, you're not getting this effect here. So this is our comparison glasses, and we found that we got these differences with the EEG, ear temperature, and affect with the experimental glasses, but not the control. And also there was a significant correlation between the EEG findings in the theta specter and ear temperature. And we felt that the ear temperature was a reflection of cerebral blood flow. That was hypothetical, but we had a rationale for thinking that.
I think that's brilliant. That's very insightful.
Then we follow. Actually, this was done 2 years earlier. So this was 70 psychotherapy patients in my practice. 60% reported at least a 1-point difference on a 5-point scale, and 23% reported a 2-point difference. So you see, not everybody's responding, but so here in this group, a 2-point difference on a 5-point scale is a 40% difference between sides, and that's and I use it therapeutically, and I'm going to explain how I do that. And then later, I'm bringing in biophotomodulation to do this. But I'm relating psychotherapy and neurophysiology with biophotomodulation.
Cool.
So this is in my book. I have a number of tape transcripts from tape recordings of patients. And this is a gentleman who was not in the book, but I had treated him about 5 years earlier, and we terminated successfully his treatment. He came in for a severe cocaine habit and was treated successfully. And I wrote a paper on the treatment of cocaine abuse with psychotherapy, and it is still cited by the American Psychiatric Association treatment manual for substance abuse. So I just want to read this. It's a couple slides, but it'll give you a sense of how I use it in my practice. So he comes in, and this is in the middle of our talking, and he's looking out one side, and I ask him how he feels. He says, anxious because I feel I can't see what might be coming at me from the other side. And I ask, is this a new feeling or a familiar feeling? He says, sort of familiar because I'm in business and you never know what's about to happen, definitely unknown. I ask, would you try the other goggles? And then, how much anxiety are you feeling? Looking out the left side, right brain. I think less, mild. Can you describe the difference between how you feel on this side versus the other? I'm more relaxed on this side. On the other side, I was a little more uptight. Now, he had problems with his father. That's what we understood in his psychotherapy, and we'll get to, you'll see how that comes up here. Let's put the other pair back on. How do you feel? Same as before, not as comfortable as the other side. Not a good sign here. I'm just thinking about things I did in the past and everything about me then. I didn't really think about anybody but myself and the abuse. Some of the things I've been through in life. This is not what I want to remember. Not good. Can I take them off now? Now, I just want to ask you one more question. Can you relate these uncomfortable feelings to your father? I don't know. I was never comfortable around my father. With these glasses on, it's sort of like dealing with him all over again. It's always the unknown, always a pressure and a problem. You feel, you feel the unknown. You have, anyway.
You have the tension.
So let's put on the other glasses. So this is the right brain. It's good side. More relaxed, more focused, clearer. And again, it's within seconds. It's like immediate. Now, if you think of your father on this side, I can deal with him on this side. I know how to handle him now, and I don't think he'd get me upset. And I wouldn't do the counterproductive things if I looked at him out this side all the time. I'd feel more pity for him and for the relationship. I don't think I'd want to abuse myself by using drugs. What would someone have to do to get you to use drugs feeling the way you do on this side? Well, I don't think it's an option on this side. Would they have to have a gun or something? Oh yeah, they'd have to do some extreme things. On the other side, yeah, I could see myself doing it on the other side. And that's typical of what a therapy session's like.
That's cool.
Yeah. And so I got friendly with Joe Bogan, who worked with Roger Sperry, who was deceased by this time, and made a few trips out to California, and we did a study with the last two split brain studies from the California series, and they had never really done a good psychological evaluation of the two hemispheres. So the protocol that I designed was I asked a question like, how much do you feel? And a word would come up on one side of the computer screen and the other, and there'd be two different words. So one side might say honest, and the other might say depressed. And there were positive and negative words, like honest versus dishonest, or feeling well versus anxious. And what we found was that there was a consistent response to each hemisphere, but different. So that in one patient, his right hemisphere had a very positive view of himself, but his left hemisphere had a negative view of himself that was consistent on the 35 questions and was statistically significant. We published this. And the other patient had told me before the study that he was bullied as a child. And so I threw in 17 questions about bullying. And his right side was very upset by the bullying, but his left side was not. And the way the patients responded was with their hands. Their left hand or the right hand would point to a peg. There were 5 pegs, and they ranged from 0 to 5. And we had 2 observers watching their hands and noting their responses. And both sides could respond very well. And so it was a very interesting study. And that patient who was upset in his right brain about the bullying, as he had told me, he wasn't upset about it in his talking left brain. It happened so many years ago. So this is a study, this is a gray matter volume, and it's just showing that people with a right negative valence who were male had a higher total gray matter volume. And I'm not sure what it means clinically, but it just was one of a number of MRI findings that we had that showed that the hemispheric emotional valence has real physical properties. A study that we're about to submit is a computerized test for emotional valence because the goggles are perceived by the Academy as goofy and even though they're tremendously effective clinically and experimentally, but they're unappealing. So we devised, or I came up with a computerized test that is submitted for a patent. And what we found was in 50 subjects that it correlated very, very highly, significantly with the nucleus accumbens and significantly with the amygdala, such that if you had a left positive hemisphere, left positive hemispheric valence on this test, your left nucleus accumbens was larger than your right, and your amygdala was smaller on the left than the right. And if your right-sided was positive, your nucleus accumbens was larger on the right, and your amygdala was smaller on the right.
Very significant work, and this is going to lead into your addiction work, right? Those are the big deals, right?
Right. It's actually good for most psychiatric disorders, but had an opportunity to apply for a grant, an SBI grant by NIDA, and so we applied for an experiment with addicts, and in my practice I have a lot of people with opiate use disorder. But I have other types of patients as well. And the opiate use disordered patients all have PTSD, anxiety, and depression. So this was an fMRI study, and we used these goggles with 2 windows, and they'd be in the scanner. We'd ask them to look to the left or to the right. And these are the results we found, that when they're looking to the left visual field, their right brain became active relative to the left. And when they looked to the right visual field, their right brain was quiet and their left brain was active. And that's what we expected with the visual stimulation. The visual stimulation is interesting because it stimulates the opposite hemisphere. The light goes straight back. So the patients are confused because they expect the vision and the light to be on the same side, and they're opposite. And they respond oppositely. They respond correctly, but they're initially confused by that. This is the study with Alvaro Pasqualeone, and I'm going to try and move these. Can I move the pictures?
Well, we can see it. Just I moved this out of the way.
Okay, well, there are some dots down below here. Essentially, what it's showing is that these are people who have a left negative hemisphere, and everybody did very poorly. 20% is a poor response to TMS, and everybody but one left-handed female had a poor response, who had a left negative hemisphere. People who by the goggles had a left positive hemisphere did very well. 80% of them had a greater than a 20% improvement, and I forget the and we're blocking them, but a very high percentage went into remission. There was a very large difference between those, the percent improvement on a Hamilton score between those who were predicted to do well by the glasses and those who were predicted to do poorly.
Correct.
I tried to get Vero, the TMS team at McLean, and other experts to simulate the right side with TMS, and couldn't get anybody to try that for some reason. And I replicated this with a group in Canada, and the p-values are almost identical. In this study, we used a Beck scale instead of the Hamilton, but the statistics were amazingly similar. And in both studies, we found that that males did much better than females. Females respond, but not as robustly as males, and that seems to be consistent.
So we'll go back to that one second, just to clear up a thing. This is a reproduction of just the left. No, this is that one. One back. Right?
Okay.
So this is again just left-sided stimulation.
Yeah, the TMS is always throughout the world, always given to the left side. And do you know why?
No, I don't.
Yeah, okay. Neither does anybody else. Okay. But there's just a feeling that left is good and right is bad. You know,
that's kind of opposite of the sinistra, the sinister, the reading that the left hand was, that would be right hand. So yeah, right brain is going to run the left hand, which makes you sinister. So that's bad.
Yeah.
That's probably perception.
Yeah.
So what you're saying is that, what was the p-value in responsiveness, prediction of?
The p-value is well, it looks like it's a correlation between their improvement and their
left-sided positive valence.
Yeah, it's actually left minus the right.
Okay, good.
Mm-hmm.
Good.
But essentially it's their hemispheric difference.
Gotcha.
And it correlates with their improvement in depression.
Gotcha.
So because I couldn't get anybody to move the TMS device over to the right side, I guess it takes a few people to move it over. I decided I mentioned I had been familiar with near-infrared spectroscopy, and I knew that near-infrared light went through the brain, and so I called the Wellman Center at MGH and spoke with a PhD and wondered whether I might apply a near-infrared light to a hemisphere, and they said, well, if it doesn't hurt the skin, it won't hurt the brain because it decreases in power. And then I got, eventually the person I was talking to wasn't that interested, and I got connected to Mike Hamlin at MGH. And he and I continue to have a very positive relationship, and we embarked on the first pilot study using photobiomodulation. It wasn't called that in those days. So it was a pilot study of 10 patients, and I'll review that for you. And so it's the first study for a psychological cause using light on the brain. And so these were patients. They all had depression. Most had clear anxiety disorder. Half had PTSD. And I would say the other half had a history of maltreatment, didn't necessarily have PTSD. And 7 out of 10 had a history, not current use, but a history of opiate use disorder. Here is a picture of my device. It's a homemade device. Has an LED heat sink, and a computer fan. And these pads over the patient's forehead are near-infrared spectroscopy that measure blood flow. Patients wearing goggles. I'm not clear that goggles are needed now. Some people are using near-infrared light to treat the retina. But again, this was 11 years ago. This shows an increase in blood flow more on the left side than the right, and the green is the combined. No, the green is the right side. This is the left side, and blue is the combined. Now, someone called our lab and complained very vociferously that the LED light would affect the near-infrared spectroscopy. And I had explored that extensively prior to the study to see that it wouldn't. And because I was using a continuous wave, the near-infrared device wouldn't pick it up. But I wasn't sure how to prove it. And I looked back at the data. This is many years later. And I found that females didn't have an increase in blood flow that was dramatic. They had a small increase. Men had the huge increase in blood flow.
That's right.
These are arbitrary units, so I don't know, what the actual increase is. But that proves that the increase in blood flow was due to the light and not tricking the near-infrared device.
Nice. Well done.
Yeah. And here are the results. So they had one treatment, 1 4-minute treatment. It was a bilateral treatment. Again, I wanted to do a unilateral treatment, but and I did some measurements about how they responded to each side, but it's a complicated result. But from one bilateral treatment, 2 weeks later, they had a dramatic decrease in their Hamilton score. They went from an average of 29 to 10.65. Excuse me. And
this is that you applied the light to one side of the head and then the other side of the head. How many minutes do you recall?
4 minutes on each side.
4 minutes on each side. So we had a 23.5, a 23.8, so 24 on the Hamilton out of 40, down to about.
You're right. Yeah, I misread that. So 23.8, and it went down to 10.65.
And it kind of stayed around after 4 weeks of one treatment.
Yeah, that's right. So it started to come up, but it did not. It was still notably down. Now then, I looked at. I didn't publish this in the paper, but I later looked at the difference between males and females, and males had almost a 70% decrease in depression. Females about a 40% decrease. 40% decrease in depression is still not bad. It's better than Prozac. Or I don't know if it's better than Prozac, but it's around the Prozac area. Whereas 70% Prozac can't touch. And half were men, half women in the study. The anxiety scores were actually more impressive. There was a 65% drop in anxiety score 2 weeks after a single treatment. And that hung around. So it went from 23 to 8.1, and then 4 weeks later it's at 14, beginning at 23.
Cool.
But here's an interesting thing. I asked the patients, do you feel it helped you? And they weren't clear. So it showed up on this test, but one guy said, maybe it did help me. My ex-wife isn't bothering me too much. But he had to sort of think about it, and it wasn't like a clear result. When I get to the light, we get an immediate result, and it's profound. So these people didn't clinically notice their improvement. But
when you think of, I used to say that on a subjective scale, when the brain changes, the subject is difficulty. It's like to say, you don't know that you're going deaf, but the rest of us do. You follow me?
Right.
They don't perceive it because it's inside them. So at least we have some measures.
Right. But when I get to the my experience with the light, we're gonna see some dramatic changes.
Okay.
More like the results with the goggles. And this might be because we treated both sides.
Gotcha.
I
like it.
And remember the guy in the lab with the goggles? He had kind of remarkable immediate
got you.
dramatic effect. So I didn't see that with this study. Again, with the Hamilton anxiety scale, males had an 80% decrease in anxiety. Females had close to a 50% decrease in anxiety, both of which are good, but it shows, again, it seems consistent that the males are responding better to this than females. So I want to compare bilateral treatment to unilateral treatment. Bilateral, no obvious improvement, requires a test to observe improvements. The unilateral treatment I'm going to show you, you get an immediate response in 84% of patients. Actually, about 55 report an amazing response. About 30% have a positive response, but it's not amazing. But it's significant and useful. And about 5 or 10% don't have any response. Now, these are patients. You'd probably get a lower response rate on the street. And it lasts for about 3 days, one light treatment, unilateral. Bilateral treatment, modest improvements 2 weeks after the treatment. Unilateral, there's an immediate improvement. Bilateral, no, I don't have any clinical experience with it. I've got 2 years experience, probably 3 now, in clinical practice with opiate use disorder, more than 1,000 treatments given as an off-label adjunctive treatment in my practice. Bilateral, no clinical experience. In my practice, I've had no relapses or overdoses. I did, since this slide, one patient sort of ghosted me and turned out he had a relapse, didn't contact me, and went into a rehab and dropped out. But he was clean. He was a heavy heroin user for several years, went through several rehabs. And when he was in treatment with me, he had no use for 3 years, maybe 4 years. But then did have a relapse. Other than that, of about 100 people, there were no relapses.
Cool.
There are no observed side effects bilaterally or unilaterally. And I mean none. It's amazing. I mean, no rashes, no headache, no backache. It's just, it's just, they just experience a positive experience. Bilateral is not related to any psychological theory. unilateral can be related to my dual brain theory. And so I like that. I think it can be integrated better with their ongoing psychotherapy. And I think it needs to be combined with psychotherapy to be most effective. So here are some case examples. These are patients who were asked, I asked them after their experience, I said, send me an email telling me about your experience. And generally the emails were a lot less impressed than I was. But anyway, so here's a man, and these are typical of cases. A man who 4 years ago had a profound urge to gamble. He wrote, I have been experiencing strong urges to gamble. I received 4 minutes of light treatment that made me feel much calmer and seemed to curb the gambling urges. Both the next day, Friday, and today, Saturday, my moods have been calmer and less urges to gamble. The gambling urges have not returned, and they never returned. If I returned to the office and I had him look out the negative side, the gambling urges would return. If I put the light on the negative side, the gambling urges would return. The gambling urges, I said to him, I have a casino in the back. I said, but unfortunately, there's a cover charge. And so we had an auction about what he would pay to go into my casino. And on the negative side, I was able to get him up to $2,000. And he wouldn't go any higher than that. And then after treatment, it's a 4-minute treatment, and they start to respond in about 2.5 minutes. He said, no, I don't want to pay. I don't want to go back there. We both knew that it was an imaginary casino, but he took it seriously. The other email is,
excuse me. Imagination is the playing field of the mind. So.
Yeah. No. I mean, I think he was serious about what he'd pay if I had a casino in the back.
I agree.
Another patient who had been struggling for 4 weeks with strong heroin urges was first treated with transcranial near-infrared 3.5 months ago. He wrote after his first treatment, I think it might have had some positive effects towards craving. Today, I haven't had bad cravings at all. And also, I noticed when I get thinking about using, I don't feel the urge to use. I don't have the cravings like I did yesterday. I feel positive today, more relaxed, happy, not worrying about, not worrying and really not craving. The patient's drug cravings have not returned. This is a year later. And again, the email is very modest. I think I was kind of amazed at his improvement. And I have I did audio recordings, and I have permission to share this with you. Can I play this?
Sure. Let's see if it goes. Sometimes those are a little tricky.
Okay.
Sometimes those are a little tricky.
Okay, so we may not be able to get that. What we hear is that before the treatment, he is well, he looks at a photograph of an angry man, and he's shaking. He's physically shaking. His foot is vibrating with an amplitude of about 1 inch, and And after the treatment, he's not shaking. He feels calm. He can look at the picture and doesn't feel anxious anymore. This is a 4-minute treatment. And again, the effects start in about 2.5 minutes. If I put the light on the other side, they will actually get worse. Recently, I offered a 4-minute unilateral treatment to the hemisphere with more positive valence as an off-label adjunctive treatment in my clinical practice to my patients' usual psychotherapy and medication. So what I'll do is, see if I put the light on the negative side and they see me as critical and they feel lousy and they have drug urges, it tells them, and then they go away on the other side. It explains that their problem is located in one hemisphere and that it's related to their past traumas. Because on the negative side, I look like their critical father or their critical mother or the guy in school who bullied them. And so we get to see that kind of a whole spectrum of the relationship between their past traumas and their anxiety and their depression and the attempt to deal with their anxiety and depression through opiate use, which then leads them down a rat hole. And so
can I maybe just talk just a second about this, the memory and the embeddedness of the memory, and then
they'll remember the memory on both sides. I'll tell you a little vignette in a second, but so it's not that they won't remember that their mother was really nasty and condescending and critical of them on their positive side, but it won't bother them. It's like they can look at the picture, excuse me, of the angry man out the positive side, and he doesn't bother them. Sometimes they'll say he looks like he's smiling.
Gotcha.
When he's obviously not. So they'll remember that their mother, was nasty, but it doesn't bother them. Sort of, I may have a patient who is having some transference issues and sees me as very critical or unpleasant, and we can either work it out in the transference or not. I lost my train there.
All right, hold on. I'll get that. I'll take that part out. In my question maybe too, but let's go with the you're saying that I'm gonna read this part that you didn't get to read yet. The adjunct treatment yield immediate and consistent results. Okay.
Okay. That they don't remember their trauma on the good side. They do remember it, but that they don't feel negatively affected by their trauma, just as they can look at the picture of the angry man and not feel upset by the angry man. And so the treatment becomes the treatment of the negative side, and I get the patient to use his healthy side to be like a good father to the little boy inside them. And this is very effective clinically. Patients do very well. And this is just data from the study measuring their immediate response to the treatment. And it was a very positive. So they had an anxiety of 7.1 before the treatment, and it went down to 4.4 after the treatment. I have a paper in submission, so I can't go over the data of this paper with you, but it's entitled "A High Effect Size for Unilateral Transcranial Photobiomodulation for the Treatment of Opiate Use Cravings" in a double-blind, placebo-controlled evaluation of efficacy and safety. And on September in 2019, my company, Mindlight, was awarded an SBIR grant from NIDA to study the safety and efficacy of unilateral TBM in 32 patients with current or recent opiate use who still have opiate cravings. They were treated with either sham or active treatment twice a week for 4 weeks and follow-up for 3 consecutive weeks. We're still working on that paper, but the results look very promising.
And so you could have captured it within that window based on your preliminary work. You're going to capture a lot of those changes that you saw. So that's positive. What does the NIDA stand for?
That's the National Institute of Drug Abuse. They're the people who gave us the Small Business Innovative Research Grant.
Anything else, eh?
Well, let me see. I think I just wanted to say again, that I have these conflicts of interest, and I have a patent for determining which hemisphere is positive, and then treating that hemisphere with photobiomodulation. And I think in terms of the future, I hope that the dual brain psychology might become more accepted and used and maybe integrated with photobiomodulation.
Thank you, Doc. Now, let me just poke at you a little bit, and you respond as you see fit. Because I know that you've got the publications and stuff, things you can't talk about, and maybe some intellectual property. But, you say that from what we understand, let's say putting light energy into the brain to whatever level that you're doing it, because we don't know the parameters, but that would seem to accelerate the activity, the metabolic activity of that side of the brain. So I think what you could say is that, you're giving always look on the bright side of life. You're putting a little bit more brightness into the positive side. Would that be a good succinct, a good synopsis of what you're doing?
Well, I would see it a little bit differently in that many of my patients have been living in their negative world and in their negative hemisphere, and it dominates their whole mind. And so this shows them that it opens a window that they'd never seen before, and that for the first time they can see that they could be successful, that they could be appreciated, they could be valuable, and that there's such a contrast between the two experiences, how one side versus the other, makes a person think, and it lays out the blueprint of their psychopathology. And gives them a guide to what they need to work on.
So your I like that therapeutic window. You know, you're giving them a space to move into a perception that they didn't have before.
Yeah.
Because
And to use that mature mind to become their own therapist.
wow, that's deep. Now, can you talk to me about your, what is your hypothesis and stuff? I'm going to go back and read that article, but your hypothesis on what does this photonic energy do to the mind? I mean, how does it do that? How does it do that?
Well, I don't think we know that yet. In other words, so we know, that near-infrared light will stimulate ATP, it'll stimulate brain growth factors and decrease inflammation, and a host of positive effects from the brain, increase blood flow. But how it stimulates a mind, that hasn't been investigated. And I think that it probably has something to do with biophotons and tubulin and quantum physics. But I think that's something for the future to be discovered. But I think you're bringing out a important point here that in 2.5 minutes, or with a visual stimulation, it's seconds. We don't have time to decrease inflammation or increase growth, brain growth factors or ATP, and so I think that the light somehow is stimulating biophotons, which I think are interacting with quantum field theories that are changing experiences associated with information in one hemisphere versus information in the other.
So I love that. Thank you for that. Now, what I'm trying to point out is that you have used, directly light energy to help people deal with emotional trauma. It's part of their emotional healing, correct?
That's right.
Now, let me ask you this. Why do you think that they get fixated or stuck on the negative aspect? Why do you think that they ruminate and they live their life in the negative side? Why does that happen?
Well, I think that these are people who had severe negative experiences, and severe negative experiences have a lot of salience. That's what PTSD is about. So someone who's in Afghanistan and has some terrible experiences and gets PTSD, well, that gets embedded in the brain, and what I'm saying is that the PTSD or maltreatment gets lodged more on one side or the other, and I don't know exactly why that is, but I think it has to do with development, and probably from Dr. Teicher's work in our lab at McLean. I think it has to do with the type of maltreatment and the age at which it happened, so certain types of maltreatment at certain ages may get stuck more on the left side and others more on the right side. But I think that the traumas and maltreatments tend to get stuck in one hemisphere. And then as the person older, around 17 or to 20, their strong side seems to develop.
The more mature side.
Yeah.
Mature side. So that you have a developmental kick in there like that. And maybe that's part of the female, because they don't have that big, their brain develops quicker than the male in the early stages. Maybe that's part of the differences that you see, if not a hormonal basis, But I think that I'm fascinated by this work. I think that it seems sort of, how do I want to say, simplistic, But then again, if you're working with a complex system like the brain, sometimes simple is the right answer. You have to, when you look at a complex interactive system like our brain structures, we could kind of flip a coin and probably get better results than doing it the whole head. What do you say?
Well, I think that, when we get into the quantum physics of this, it gets very complicated. And will require decades of more research to understand well. But I think that it is interesting that looking left versus looking right can have profound impacts on a person's experience.
I think you did
And
great.
that is simple and profound.
Thank you, Doc. Thank you for your time. Thank you for your expertise. Thank you for all your years of work. Thank you for participating with us today.
Well, thank you for having me. I've enjoyed it. Thank you.